My name is Liliana Palomino, and I work with Diana. I support Diana in the JI work, and I am really happy to be here. My pronouns are she and her.
Thank you, Liliana. I'm Deanna Simon. I work with Liliana and a bunch of others on the Community Partner Outreach team here at OHA. We support our community partners and we help make sure you have what you need so you can help your clients. And we love what we do. So thank you for being here with us today. Katie, can you introduce yourself briefly? And then of course you'll have a lot of opportunity to speak in a little bit.
Sure, I'm Katie Beck. I'm a Senior Medicaid Operations and Policy Analyst here to talk to you about transitions of care for the justice-involved population.
Thank you. And is Janelle, oh, let's see, is Beth here or is it just Greg?
It is just Greg.
Greg, do you mind introducing yourself?
Hi, I'm Greg Fritz. I am the Operations Manager for the Justice Involved email team.
Yay, thank you for being here in case any questions come up. Christy from Policy. Right, I'm going to introduce Christy Taylor. She's one of our policy analysts and one of our main connectors to the policy team. And she is incredibly helpful when it comes to figuring out what is possible and what's available for our clients. And she's really our MAGI policy specialist that we work with. That's for, we're not going to go into MAGI and non-MAGI, but that's for OHP for those who are under 65 and not disabled. And then we have Janelle. Janelle, can you say hello?
Hi, can you guys hear me okay?
Sure can.
Awesome. Hi, I'm Janelle White. I am a policy analyst with the Aging and People with Disabilities Medicaid Financial Eligibility Union.
Yep, thank you. And Janelle is actually going to share with us an exciting announcement today. And then after that, we're going to spend the rest of the time talking about this thing called the waiver that many of you may have heard about. And we're going to share with you what is the waiver that impacts. Do you mind muting? Thank you. We're going to talk about some of the waiver provisions that would impact the justice-involved individuals if they are awarded, and we hope they are. And we're going to ask for your input to inform that waiver process. So that's what we have on today's agenda. But first, I do want to turn it over to Janelle. Hopefully the noise isn't too bad, to share with us an exciting announcement.
Hi. So APD policy has recently decided on a change to help those individuals who are releasing from incarceration, who had OSIP-M benefits prior to entering incarceration. So as you know that if those individuals are eligible, they will be restored to MAGI first for most individuals while they're waiting for the extra steps that are needed for non-MAGI determinations to happen, such as the interview and ABS. But there's a population of those who still have Medicare when they're released that can't be, they're not eligible for MAGI because of that Medicare. So for those individuals, we will actually go ahead and restore them to OSIP-M immediately, and we will waive the need for that ABS, that non-MAGI interview, those extra things that are needed to determine eligibility, and we will make that determination at the next renewal date. So that doing this will make it so that non-MAGI members don't have to have that 1 to 2 week delay that they have had in the past.
Yeah, this is terrific, and it really speaks to some of the challenges that we've heard from you who are serving this population, that when people are releasing and they're 65 and over or disabled, so they're not eligible for that MAGI where they can get that immediate benefit, they've had to wait. So the agency has been working on many fronts to remove barriers, and this is one of them. So I want to take a moment to make sure that has sunk in. And for those of you where the MAGI and the non-MAGI and the OSIP-M, want to make sure everybody understands this announcement, right? OSIP-M is the full OHP benefits, but for those who are 65 and over or disabled, and they won't have to wait for them anymore. So I want to take a moment to open it up to any questions that people have so we can be sure that everybody understands this exciting announcement. Alicia, I thought you would like that. I do see a question here. It's about the APD AICs. What that means is an adult in custody who, I think you meant APD there, who might be eligible for these APD benefits because they're either 65 and over or they're disabled. If they had inpatient, I'm just going to read it straight as it is. If they went inpatient while incarcerated, are they eligible to have that inpatient stay covered by the APD office? So that's about inpatient stays while incarcerated and coverage for an inpatient stay. I wonder who can speak to that. That's a little bit of a separate issue than the announcement, but it's still a good question.
I can
So-
take it.
That's great, Christy. Thank you.
Go ahead, Janelle. You go ahead.
Oh,
Sorry, I should be the same answer, but so those who are released to a hospital for an inpatient stay do have the ability to be covered by MAGI or non-MAGI.
and it's not just a hospital. We have determined that an SUD inpatient stay also qualifies. Correct?
Yes, inpatient
Mhm.
facilities, inpatient.
Yep. Thank you. I hope that answered the question. Next question. So does this mean that they will have a QMB, which is help paying for Medicare premiums or other Medicare costs, and OHP when they get released?
This is specific to OSIP-M medical benefits. We have not discussed immediate enrollment in QMB. I don't know that that's something that we would do. I'd have to talk to my team because QMB can, it's typically a going forward thing and will reimburse because it takes a little while for them to get enrolled into QMB anyway. So that's a separate discussion. This change is specific to OSIP-M.
Yep, and OSIP-M is, I'll say it again, is full OHP coverage for those who are 65 and over or disabled if they meet the criteria. All right, here's another question. Who is the point of, let's see. Kelby, I hear that you have a request for a point of contact for getting inpatient stays covered. We'll address that separately, and maybe if one of our organizers has information, they can type an answer into the questions box. Here's our next question about the announcement. Will clients eventually have to do an interview for those non-MAGI benefits, or is that interview going away altogether? Do you know?
Right now, yes, they will eventually have to do an interview, but we are willing to waive it until their renewal is due. So at their next redetermination is when they'll have that interview.
And the benefit of that is that it does not hold up that OSIP-M OHP coverage upon release. Excellent. All right, any more questions for Janelle before we move on? Okay, I think we're good. We don't have any more questions about this. Well, I think what I can say, and to address the question that's in here, the question is, does this affect the process of submitting a 7100 if we're trying to get somebody into treatment upon release? I think what it really means is that you will still submit that 7100 for restoration of benefits as you normally would. And if that's somebody who would normally have a delay in getting those benefits restored because they're 65 and over or disabled, they would not experience that delay. But it won't change your process. It will just change how quickly they get their benefits restored. All right. Well, if there are any more questions, maybe we can answer them in the background, but I'm going to move on to our next topic, if that's all right. So thank you, Janelle, for being here to share that exciting news. I love it when we get to share that good news stuff. Okay. Our next topic is the 1115 Medicaid demonstration waiver. And I'm going to give a quick little background before I pass it over to Katie Beck, which is that every 5 years, the state has the opportunity to ask the federal government for flexibility. And we are in that process right now. And there has been a big eye for how much flexibility we can ask for to benefit justice-involved individuals. Sorry, this was something that I didn't catch earlier. It's not just justice-involved adults. It's also, so I'm just going to do it on the spot here. It's also justice-involved youth. So there we go, on the spot correction. And I'm going to pass it over to Katie Beck. She's our Senior Medicaid Operations and Policy Analyst who has been very involved with the waiver work. So Katie, thank you for being here.
Yes, thank you for having me. So we're going to do a little overview of the waiver, focused on how it impacts the justice-involved community. I do want to just note that the waiver is pretty large in scope, so we're really kind of honing it in to what's most applicable here. The waiver, so the federal government sets the rules on what Medicaid can and cannot do. The waiver allows us some flexibility in waiving the rules so that we can operate the Oregon Health Plan in the way that we believe as the state of Oregon, from what we've heard from our community, is the best way to support the people that we're here to serve. So every 5 years we request every 5 years we have the ability to request a waiver. After 3 years, we have the ability to request an extension. Many times it's simply an extension over the prior waiver, but there have been several points in time where we've done pretty exciting waivers. So the first one was, the creation of the Oregon Health Plan in the 90s, and then in 2013, the coordinated care organizations, and then now we're looking to really expand even further. Next slide. So with this waiver, we have an eye on advancing equity. And we looked at it under 4 different policy concepts or frameworks. And you can go to the next slide. The place where we're really focusing is, in this conversation, is the transitions. So improving health outcomes by streamlining transitions. This will have a very exciting direct impact on the people in custody. If it's approved, I should say. The waiver application requests I can't read that last word there. My screen's blocked. Oh, requests most impacting justice-involved clients are eligibility. So that covers who can be covered by the Oregon Health Plan, where we want to deviate from those baseline federal requirements. The covered services. So the types of things that the Oregon Health Plan can pay for using our federal funding, and the delivery system and payment. Next slide. Next slide. So the proposed waiver strategies that we're looking at here are to request a waiver of the federal eligibility rules that allows people to have Oregon Health Plan coverage when they're in prisons, in county jails or local corrections, in juvenile corrections, in the Oregon Youth Authority closed custody corrections, the Oregon State Hospital and psychiatric residential treatment. Next slide. So we're going to get into a little bit more of the high, well, it's still high level, but the details around what this means for the different settings. So for the Oregon Department of Corrections, we're requesting to create an OHP care coordination benefit 90 days prior to release from the Department of Corrections setting. So this is state prison. They have longer stays in general than local or county jails, local corrections or county jails. So their benefits will still be suspended when they go into the Department of Corrections. But 90 days prior to release, if they're otherwise eligible for the Oregon Health Plan, we'll get them enrolled into a coordinated care organization that is associated with their region that they're going to be releasing to. That CCO will be responsible for doing the assessments and screenings for behavioral health needs, which includes drug and alcohol screenings, as well as their social determinant of health assessments. That CCO will also be responsible for finding available providers and scheduling appointments for these individuals once they release from the Department of Corrections, so that when they walk out the door, they have their providers identified that are also able to take new clients and appointments scheduled. Part of this also requests a 60-day prescription medication supply that augments the 30-day supply provided by the Department of Corrections. One of the things that we heard very clearly from the Department of Corrections, as well as others, is that 30-day supply just was not cutting it with the delays in access to care. So between moving up the initial assessments and appointments with providers and the extended prescription supply, we're really optimistic that this could make a significant impact on the experience for these people that are coming out of the Department of Corrections. This, as I said, this will enroll the individuals into their CCO that's associated with their release area prior to their release. So no more waiting for 2 weeks to get into a CCO so that you can then wait for several weeks to months to then get into providers.
So Katie, I just want to take a moment to pause here before I go to the next slide and just remind people that, we ask for your input in various forums, and we asked for a lot of community partner input when it came to developing the waiver requests that we are asking of the federal government. And I hope what you can see here is that your voice has power and your voice has a lot of strength, and that the agency really heard what is needed and is asking for it. Of course, we don't know if they'll all be granted, right? But even if we get part of this, it could be a big win. So I hope you're all jumping up and down and jumping out of your seats right now, because these are huge. A lot of work went into this with lots of community partner input. So even though we tend to move slowly as a state, we do move. And this is big movement. If any of this happens, it's big movement. So it's pretty exciting, and it really resolves a lot of the barriers, or it will resolve, if it's awarded, a lot of the barriers that you have all experienced and shared with us.
Thank you for very clearly saying that. The proposals in the waiver were really very directly informed by the communities, by the people on the ground in the communities, such as yourselves. So your voice is very important in shaping how the Oregon Health Plan looks going forward.
Yep, thank you. I moved to the next slide. It looks very similar.
Oh.
There you go, Katie.
I was just looking at that, trying to figure out, like, wait. Okay.
I snuck it up on you.
So we just talked about the Department of Corrections setting, that's the state prisons. Now we're talking about county jails and local corrections. We're requesting something different for these settings because the lengths of stay are typically much shorter. On average, I believe the data shows us that it's about 15 days, with the majority being catch and release. Some are longer, but the average is 15 days. So in this setting, we're requesting the authority to retain full Oregon Health Plan benefits for the duration of custody. So we will not be suspending their Medicaid benefits upon entry into or arrest in a jail or local corrections. We're requesting that as part of maintaining their eligibility, that we include this social determinants of health benefit package that supports them in preparation for releasing back to the community. So this will get a CCO in to do the assessments and screenings for their behavioral health needs, drug and alcohol assessments or screenings, and their social determinant of health assessments. And later in this presentation, we'll talk a little bit more about what those social determinant of health assessments are, or what we're assessing for there. We're also going to really be trying in this package to help make the linkage and appointments to available providers in the community upon release. So they're identified, their appointments are set, so when they walk out of the jail, they know when and where a provider is available for them. Another piece of this that is a really significant component if we receive approval from the federal government is that it'll maintain some continuity of care for individuals while they're incarcerated. So for people who have ongoing chronic health conditions that are treated, or they have a particular medication. Psychotropics are one that I heard very clearly from the jail communities, that when somebody gets arrested, they come in, they don't have the information on what medications they're on, so they just decompensate even more. So maintaining that CCO enrollment and setting up the mechanisms that would notify the CCO of somebody's arrest, change in setting, so that the CCO is responsible and can reach out to the jail and make sure that those chronic conditions or serious medications like psychotropics are maintained while they're being jailed. Will help to improve their stability and their success, even the potential for success upon release. So
Then
we
I
can go to
think-
the next.
Yep.
Go ahead.
Piece of this is that they can really maintain that CCO enrollment. And if you just said that, Katie, I'm sorry, but I think that there's this big stickler point of CCO enrollment upon release that this will resolve.
Yeah, I think I'm sure you all know that the benefit to that, getting people into treatment quicker, is just enormous. I get pretty excited about this work because I feel like there's so much potential for really positive social change if we're able to get the approval from the federal government. So the covered services. So we're requesting to waive some of the federal covered services rules that would allow us to use more types of providers, such as traditional health workers and peer support specialists, to help provide the linkage and administer some of the navigational supports, so that we're meeting people where they're at, instead of expecting them to come to us. We're also requesting waiver of the covered service rules to allow us to develop a social determinants of health benefit package as part of the Medicaid, as part of our Medicaid program. So this is open to a number of different categories of populations that are going through significant life-changing transitions, such as becoming homeless, getting out of jail, entering or leaving foster care, leaving the Oregon State Hospital. And these cover things such as housing, transportation, food assistance, and employment supports. I think we'll talk a little bit more about what these components look like in just a minute. But this really is looking to have an eye on a short-term benefit that can help improve people's stabilities and likelihood for success upon leaving the correctional settings. So if the waiver is granted, and this is a big if, our conversations with CMS have been they've been very engaged in the conversation, which is exciting. But it's a pretty big ask that we're making. So we'll see what happens. But if the waiver is granted, CCOs will be responsible for that initial assessment of the individual when they're in the Department of Corrections or the county jail. They'll be determining, do they have chronic health conditions? Do they have, ongoing medications? Do they have needs for social determinant of health upon release? Once that high-level assessment's done, they'll be making referrals, likely to regional providers and community-based organizations to do a more detailed assessment based on their area of expertise and the community that the individual's releasing to. That'll get into the depth of what kind of housing supports are needed, what kind of nutrition or food supports are needed. I think we missed one point there on that last slide, if we can go back. I know that, well, I should say I know. I understand that you all meet with adults in custody already, and that is wonderful, and the value added that you all provide is just so significant. And I feel like the potential to capitalize on that good that you all do is it's very exciting. So one of the things that we really want to explore with you all is, based on your insights and your experiences, where do we expect, or where could we be planning for barriers that that could make this fall apart, or create hurdles that that we can plan for to mitigate going forward. And we'll have some questions down at the end to get into some of that, but I just want to kind of prime your brains for that.
Thank you.
Thank you.
Thanks for catching that.
Next slide. So for the housing supports, and I just want to stress that the social determinants of health benefit package is a transitional package. So it could be, what we're requesting is up to 12 months. But we're looking to have periodic assessments or reevaluations of need so that we don't have people overutilizing and relying on the service when there are other longer-term services out there, or if no service is needed. And it's really just intended to be kind of a bridge to re-entering the community and getting linked up with the existing services. So we're not looking to replace any mechanism that currently exists. We're just looking to fill in some gaps. So the housing supports could be rental assistance, temporary housing. If somebody's got backed rent that is a barrier to them maintaining their housing, we want to be able to help with that. Home and community-based services, It could be, handrails, utility assistance, if they need their carpet replaced because it's creating an unsafe environment for them. It's a one-time investment that will create a safe living space for the individual to stay in their home. Pre-tenancy and tenancy supports. So employment services, eviction prevention, housing application assistance, moving supports. I think that one of the things that we heard quite frequently was, great that there are some resources that are coming, but how do we help people learn how to maintain their living conditions or their housing, particularly when there's some behavioral health or substance use issues in that we need to be looking more broadly at the human experience than just at an individual service being rendered. So there's a big focus on providing educational resources and supports that meet the individual where they're at. And then housing focused navigation or case management. And this will be very heavily relying on traditional health workers. One of the other, this is probably less, well, maybe it is relevant to this group actually. So when individuals enter group housing, group homes, one of the things that we've heard is that they kind of get stalled out there because there are resources to help people get identified and moved into the house, wait lists aside, but there aren't a lot of resources to help them find independent living and maintain independent living. And so the housing case manager it'll be more than just getting them into the group housing. It's also transitioning them through to the appropriate level of housing for the individual's needs, which should then free up some capacity so that we can help people move through the system and learn the skills that they need to learn to be independent adults. Next slide.
Yeah, before we go on to the next slide, I'm going to go back a slide, Katie, because you alluded to the fact that we're going to be asking people questions in a little bit about what could be barriers to making this successful. And the piece here that I really want to make sure everybody's listening for is that the second bullet on the slide, the vision is that CCOs may end up contracting with regional providers and organizations to support the assessment process, right? So that assessment process comes into play, like the piece that comes into play is that they're going to be assessing for all of these needs. Are these pieces here necessary for this individual to be able to get care and be successful? And what we're going to be asking you is, as a provider or as an organization, or as whatever entity you are, what would it look like if you were trying to help the CCO do these assessments? And the assessments will contain these types of information. So that's why we really want you to pay attention here, so that you can answer some questions later about what that might look like or what the barriers might be. And so these are all of the pieces around housing, right? But there are a few others, and now I'll go to your next slide, Katie.
Thank you. So transportation support. So this is not looking to replace the non-emergent medical transportation that is available for our Medicaid covered services. This is looking to provide transportation services for the benefits that are under the social determinant of health benefit package. So if somebody, let's say somebody has, employment support and they've got a job interview or, an appointment to meet with a mentor, this would provide a mechanism to ensure that there's transportation for them to that interview or that appointment. And again, it's just leveraging existing mechanisms for transportation. We're not creating a new transportation system. Next slide. Nutrition supports are looking to helping people make the link to community resources. So if they need help with an application or they need help finding, where their local food programs are, it includes nutrition and cooking education. A lot of people they're not raised with, how to cook and how to grocery shop and do things that create a healthy environment, thinking of food as medicine almost. It includes, we're asking for it to include fruit and vegetable prescriptions and healthy food boxes or meals and medically tailored meal delivery. There's a significant amount of evidence that provides very, very solid links between, nutrition and its impacts on health conditions, both preventative and as almost as food as medicine, that we're trying to leverage in our proposal with CMS through this work. Employment services are looking at the individual, their needs, their assets and their deficits, being able to provide some mentoring, help them come up with a job plan, finding a placement, interview practice, as well as the transportation necessary to be able to get a job and obtain these other services. Next up, so just a high-level overview of our timeline. Right now, we're in negotiations with CMS. That's going to continue through the summer. We go through ebbs and flows with them. Right now, we're in one of our high-volume periods, and then in May, that'll kind of reduce for a minute so they can go back and do some of their internal work, and then they'll come back with another series of questions for us to be responding to. Overall, I would say that our asks are being really positively received, and they're in line with the current administration's goals. So really the question is, can we make an argument about how this is a medical service, which is a very reasonable place to be putting our efforts. It's not a question of, is this needed? It's just a question of, can this fit appropriately within Medicaid? Next slide.
Working on it. Right, so we have questions for community partners, but I'd like to take a moment I'm actually going to hide my slides for a minute and hide my screen. And Liliana, if you're available, are you able to bring some of the questions from the chat box that are relevant to this waiver discussion into the general discussion, and maybe Katie can answer them while I'm working on something behind the scenes?
That's good.
Thank you.
We actually had quite a bit of questions.
I know we do.
Just give me 1 second. All right. And if you don't hear me ask your question, can you copy and paste it again so that I don't miss it? All of us already know about social determinants of health, so who actually is going to work on these issues and do what? CCO staff.
Oh, a deal with CCO staff? Was that the last piece?
Yeah.
Okay. So the way that it is proposed to be designed is that the CCO will be doing the assessments. They'll be making the referrals to community-based organizations. The community-based organizations are the one who we envision will be providing the services. It will be a new system in that CCOs are not currently required to contract with community-based organizations. I should also say that in addition to the work that's happening under this stream, there is also a body of work happening within the Weaver to create community investment coalitions that drive the CCO's funding expenditure. So it is looking to provide a better balance of power in the dynamics within the communities. So I don't know if that helps.
I think it does. Another question, will clients know their release date ahead of time?
So that's a great question. So the Department of Corrections is, from that stance, it's much, much easier because we do know what the release date is. For adults in custody, that's part of why we're asking to maintain the ongoing Medicaid benefits, is because they don't likely know when their release date is with any confidence in advance. Outside of this work stream, I've got another one, another project going where I'm working with partners to understand what the current processes are, and the exploring how it is that we can do a more efficient job, I guess, of identifying release dates and getting that information communicated effectively. We have a lot of area of opportunity around that.
Thank you. If a client sees a nurse while they're in custody in the facility, will they be able to, will it be billable to Medicaid?
That is a great question. We've been working on a crosswalk, essentially, of what the county or prison is legally obligated to provide, and then our proposal is that Medicaid will come in and fill in the rest with the Medicaid covered services. So if it is a medically necessary service and the nurse is providing it, that'll stay with the jail. If it is a service that maybe is not a medical emergency, and it kind of hits that gray area between, could the individual wait until they're released or not, and the county chooses to have the service rendered but bill the individual, Medicaid would cover that. So I think that it's important to note here that we're really in the we're knee deep in the weeds trying to figure out some of these nuances, and where the consistencies exist in terms of process across counties versus the regulatory legal obligation. So I'm not going to have answers on nuance there quite yet. I just want to say a really big thank you to all of you for your input and the work that you do every day. The things that you guys bring up and that we hear through Deanna and Liliana and the rest of their team really do help to shape the way that the Oregon Health Plan works, and to help shape our processes when we learn that there are hiccups or barriers. So thank you all very, very much.